Hello, please do take a seat. Hi, so how can I help you today? Oh, I'm sorry to hear that. How long have you been dealing with the pain? Okay, I'm sorry to hear that. And would you say the pain is consistent? Is it intermittent? Does it come and go? How would you describe it? Okay. Right. And where approximately on your back are you feeling the pain? Is it centralized? No. Oh, okay. So it's more to the right. Okay. Can you just turn around and just let me have a feel? Ah, right. So from initial observations, I can't see anything that would indicate it being a muscular or skeletal issue. And did you say you've been managing it with painkillers at the moment? Okay, right. And how long have you been taking them for? Right, thank you. Okay, on a scale of 1 to 10, how bad is the pain? Okay, right, so it can get up to around a 10. But that's not all. No, okay, so it's not always, just sometimes, but you'd say on average around 8 out of 10. Okay, no, we need to get this under control for you for sure. Have you experienced any changes in your bowel habits or your feelings of nausea? Because I know you mentioned on your last appointment, which was 2 months ago with another doctor, you said that you were facing some issues surrounding feeling sick, nausea. Is that still there? Okay, right. And do you notice that the nausea is linked with the pain? Is it the pain that's making you feel nauseous? Okay, so you have noticed there is a link between the nausea and the pain. Okay, right. And there was no triggers when you first started getting the pain? Anything that you can identify in your routine that may have changed? No heavy lifting? No? Okay. Right, let me just make a note of that on the computer. And you're saying that the pain, it sometimes radiates from your back down to your groin area, is that correct? Okay, yep. That does sound really uncomfortable. And just, can you turn around again for me, just because I want to just... And when I'm pressing just here, does that hurt? Is it a bit tender there? Okay. And this side, there's no pain whatsoever, right? Okay. I'll make a note of that because that's very important. So it is only one-sided. Right, okay. And when you get the episodes of pain, how long do they typically last? Oh, right, so they can range then from, you say, about an hour to the longest was 1 day. Okay, and when you were in that period of time, did you notice any changes to your urine at all? You'll understand why I'm asking about this in a moment. Right, okay, so you did notice you were going a little less often than usual. Right. And did you notice any blood or in your urine? No blood? Okay, that's a good sign. what about the cloudiness in your urine? Was it cloudy? I know you might not be able to have a clear memory from every episode, but sometimes with conditions like this that I'm thinking you may have, I'll tell you what you may have in a moment, but with conditions like these, sometimes the urine can become cloudy, a bit hazy. So if you can remember anything at all. Okay, right, yeah, that's useful. So you did notice it was cloudy on one occasion, right? So any fever or chills during these episodes? No, that's good. Let me just log that into this system here. Okay, right. And in terms of family history, has there been anyone in your family that's experienced similar symptoms? Anyone be diagnosed with any kidney issues potentially? Okay, so your uncle, he had kidney disease. Okay, well, I don't think it's kidney disease, so don't worry about that. However, I'm thinking, and I'm not sure, so I'm going to have to refer you to a urologist just to be certain. But from the symptoms you're describing to me, it does seem like you could potentially be dealing with kidney stones. Okay. Do you know what kidney stones are? Okay, so basically kidney stones are little crystal-like formations that can occur. We don't know the cause for certain, but there are many theories, and they're just these little crystals that form inside of your kidneys, and they can get lodged, and as they move around, they can cause significant pain, and especially if they are moving from your kidneys through your urinal system, then you can experience very severe pain, particularly in your kidneys and in your bladder. So that's more towards the groin area when you mentioned you was having pain. And have you ever noticed any little shards or feelings of stones being passed? No. Yes, you probably would have felt that if you had have passed them. So yeah, I'm guessing if it is kidney stones, that they are still in your kidneys, and potentially that time you felt the pain in your groin area, it could have been moving further into your bladder. However, I'm not the urologist, and I'm just making these observations based on the symptoms that you've described to me today, okay? I've made a log, and with obviously the feelings of nausea and the fact that this has persisted for a few months, I do think a referral to the urologist would be in order. But I'm also going to print off some blood test forms that you can collect on the reception on the way out, and we will be testing just the basic blood levels, vitamins D, and all the blood markers to test your white blood cell count, just to make sure there is no infections and everything's okay with your red blood cells as well, because there are a few other conditions which can mimic these symptoms, and we want to make sure we rule out anything serious potentially. Not that kidney stones are not serious, and I definitely understand you're in significant pain. It's nothing to be laughed at. Kidney pain and kidney stones, I myself actually had them a few years ago, and people have compared the pain to childbirth, so it can be a very, very painful condition. Not life-threatening usually, but definitely something we need to get under control for you straight away. And has it affected your ability to go to work at all? Okay, so you're currently looking for a job, right? So I don't need to write you a sick note. Right, thank you. I'm just going to bring up some information here that I'm going to print off for you. It's just some guides and some relevant numbers to contact if you do experience worsening symptoms. Okay, right, yes. So they're going to be printed off and you can collect them at the reception on your way out. I just wanted to check in with you regarding the level of water you drink per day, or any liquids really, so long as it's not alcohol. In terms of litres, do you know roughly about how much you drink per day? Okay, 2 litres, yeah. That's fair enough and well within the NHS guidelines. However, if it is kidney stones, your specialist, your urologist, will likely suggest you to bump that up to about 3 litres per day, because people with kidney stones do tend to need more water, just because the juices need to flow within the kidneys more regularly than the average person, just to prevent stone formation in the future. And I'm also going to just print out a urine sample test for you as well, that you will also be able to collect at the reception. So yes, we just need a sample, and if you could get that back to us within the next couple of days, that will also rule out any potential infections that you may be having, because UTIs can give similar symptoms, and of course if it was a kidney infection that would be very serious, so we want to make sure that it's not that, but I'm pretty confident that it is kidney stones because you don't have a high fever. Yes, so that will be the next steps. Let me just double check here if there's anything else I need to prescribe you with. Are you okay with the painkillers you're on, or would you... Yeah, we can get something stronger for you for sure. Let me just... Yeah, so these ones are just a tad stronger than the ones that you are on at the moment, and I'll write you a prescription for that. That should be ready for you to collect within 24 hours, and we'll send a text confirmation. And do you have the NHS app downloaded? You don't? Okay. Well, there's some helpful guides as well that you can pick up at the reception, so you can self-register online, and through there you can request repeat prescriptions, and I'll have this as a repeat prescription, and we'll do a follow-up after you've had your urology appointment. But yes, let's just see. Scans. Yes, scans. You can probably expect the initial scan to be an ultrasound. The urologist will go into more detail about this, but the ultrasound scan can sometimes pick up small to large stones. But if there isn't anything visible, and of course you're still having the symptoms, then potentially we'll look into MRIs and CT scans, which are a little bit more detailed, but they can be picked up sometimes on the ultrasound, so I'm guessing that's what they'll probably do, but they will detail the information to you and the course of action when you are referred on to them. And so let's just see here. Yes, so as mentioned, just make sure you drink plenty of water. Staying hydrated is very beneficial for every function in the body, but more so if you are dealing with kidney pain. Yes, right. And of course, if you are in severe pain, like the episode where you said you were 10 out of 10 on the pain scale, I would recommend that you go straight to A&E, and if in doubt, ring the relevant emergency lines, especially if you have a fever, you feel lightheaded and you're unable to get to A&E yourself, of course, because I don't want to worry you, but kidney issues can become serious, rarely life-threatening, but they can become serious, as you are well aware, and we don't want you to live through trauma and add the burden to your life. So yeah, let me just double check. Okay, yes. Any more questions? Yeah, you can expect it to probably be a couple of months until you get your initial appointment. Yep. And in the meantime, like I said, the painkiller should just take away that severity of the pain, probably making it more of a 2 to 4 out of 10 than a 10 out of 10. So hopefully the pain will be much more manageable in the interluding period. But yes, unfortunately, the NHS resources are quite stretched, and ideally we would like to have you booked in for your first appointment within, a month's time. But other patients that I've referred on have expressed that they have waited, a couple of months, unfortunately. But yes, don't hesitate to contact me or any of the other relevant health sources in the interluding period. I do hope you take care of yourself and that you do feel better soon. So if that's everything... Oh, yeah, that's fine. One more question. Yes, so if it does turn out to be a kidney stone issue, there are a few different options. Some surgical, some non-surgical. So in layman's terms, there are shockwave therapies, basically where we kind of blast the kidney stones out of you without actually a surgical intervention. It would be done non-surgically. There are risks, and your urologist would detail them in more detail, but you can have a look online on the NHS website at the relevant surgeries and treatment options for kidney stones. There are the surgical options as well, usually done under anaesthetic and may require a stent to be in place. But the first line of defence would be the shockwave therapy. But what I'll do is as well, I'll just write this on your notes and print them out for you to collect at reception. And if you do collect them from reception, they'll also be able to help you register for the NHS app, and you'll be able to get all of the relevant information on there as well. So yes, is that everything then? No, you're more than welcome, and thank you for coming and explaining everything and being honest. And we hopefully will get you back on top form soon. Okay. Yes, you have a lovely day too, and it was very nice meeting you. And yeah, yes, it's just through there where you came back. Yeah, great. Bye.